Do I introduce him?
Okay, good afternoon everybody. I'd like to welcome you to TLC Academy. Today we have a presentation on in-servicing us with infection control and how to do infection control within our own personal lives as well as in our professional lives. And our presenter today is Cathy Johnson, who's one of the case managers from TLC. So I'm going to turn it over to Cathy and let her proceed with her presentation. Thank you.
Hi, my name is Cathy Johnson and I'm a TLC nurse case manager and I work out of the West Lebanon office. Thank you for being here today, and this is a video being taped, so if you're interested in seeing it sometime, then you can always go on the TLC Homecare Nursing website and just go to the TLC Academy anytime. I'm going to be speaking about infection control, simple practices in daily living. And during this presentation, I will be discussing the following topics. What is infection? The chain of infection, risk factors for infection, hand washing, use of disposable gloves and donning and doffing, putting on and taking off your gloves, maintaining a clean environment in the home, care of laundry, food safety, and a go-to bag for you to have in your car containing essential items for your own infection control. As you might have realized, this information will benefit not only your clients but also you as well. To begin with, infection control is such an important topic because TLC caregivers must be constantly alert for the need for cleanliness. People usually refer to infectious agents as germs. These include bacteria, viruses, fungi. Examples of infectious conditions which can be spread from one person to another are colds, flu, respiratory infections, gastrointestinal infections, which can lead to vomiting and/or diarrhea. Infection control means preventing the spread of disease from one person to another, and there are some simple steps you can take to prevent spreading any disease you may have to an ill person and to protect yourself from disease. People at risk, which I will explain later in this talk, have a more difficult time fighting off infection. Preventing infection is the best line of defense, and proper hand washing is so important in preventing infection, the most important. Here's a list of signs of infection to review with you. They may include one or more of the following. Fever. First of all, what is body temperature? It is the measure of the body's ability to generate and get rid of heat. Temperature can be taken by mouth, ear, armpit, and rectum. It can also be measured on the forehead, which I think is done more commonly today. Temperatures can be measured in either degrees Fahrenheit or degrees Celsius. In the United States, the standard is usually degrees Fahrenheit, but in hospitals or healthcare, it's degrees centigrade. What is considered normal for adults is 98.6 degrees Fahrenheit or 37 degrees centigrade. Rectally and in the ear is slightly higher, and the armpit is slightly lower. The most accurate is rectally. Fever is an elevated body temperature, and one of our ways our immune system attempts to combat infection. This is important to know that for most adults, what is considered a fever is above 100.4 degrees Fahrenheit or 38 degrees centigrade. Fever may occur as a reaction to infection, medicine, severe trauma, injury, or other medical conditions such as heart attack, stroke, heat stroke, and people have a normal temperature that they might know to be theirs. So then you can also gauge if they have a fever. The infection can be localized or throughout the body with a fever. Chills are feelings of coldness accompanied by shivering. They may arise with or without a fever. Shivering helps the body to generate heat. A client might have abnormal discharge or drainage. That might change from clear and become pus-looking. That would indicate an infection. There's swelling that can occur as a response to injury or infection or disease. It's very important to know note where the swelling is in your documentation, along with any other signs of infection. Redness, again, is to note where it is. There may be a lack of appetite, and it's important to know if it was more than a day or two, and if there's weight loss. Pain can be a sign of infection. Where is located? What words does the client describe? How much pain is there on a scale of 1 to 10? Is it self-limiting? Is it new? With many of our clients, it will be difficult to evaluate pain. We may notice some grimacing or frowning or crying out, constantly repositioning. Please note in your documentation any of these observations, if there are concerns or changes or anything that might help. Some words people use to describe pain can include, it feels like an ache, it's sharp, it's throbbing, it comes and goes, it hurts when I do this. These words are likely to be very helpful in understanding how to comfort a client. Restlessness and change in behavior. Many people will exhibit changes in behavior due to a urinary tract infection, exhibited by a sudden increase of confusion in a person with dementia. The caregiver plays an important role in recognizing urinary tract infections. They need to be on the lookout for these 6 symptoms. The need to go to the bathroom frequently or urgently. Complaints of discomfort while urinating. Frequently touching themselves. Cloudy or dark, foul-smelling urine. A new onset of incontinence. Any change in mental status or behavior, such as sleepiness, hallucination. They might say that they see bugs crawling on the ceiling, seeing things that are not there. Restlessness or yelling if it was not present before. Report as soon as possible to the family and TLC as having an early warning sign, and a urine specimen can lead to a successful early treatment. As TLC caregivers, you've been so helpful in noticing these signs of UTI in your clients, and this is so important in infection control. Keep up the good work in this regard. Any signs of infection are important to notice and report to the family and TLC for further monitoring and follow-up. So just to review the signs of infection again, these include fever, chills, abnormal discharge or drainage, swelling, redness, lack of appetite, pain, restlessness, and change in behavior. With personal hygiene care, bathing, dressing, these activities provide a perfect opportunity for noticing some of the signs of infection in your clients. To understand infection, I would like to briefly mention the chain of infection. For a person to get an infection, there are 6 key conditions that must be met. These key elements, or links, are known as the chain of infection. It's important to note that the chain of infection can be broken by taking away just one of the 6 required links or elements. I'm going to say that one more time. The chain of infection can be broken by taking away just one of the 6 required links or elements. There are 6 links in the chain. The first link is the pathogen, the germ, capable of causing the disease. For example, bacteria, viruses, fungi or parasites. A break in the chain might include chlorinated water or a use of disinfectant and hand washing. Number 2 is a reservoir or a place where the germs can live. The human body, a person with a common cold, can be the reservoir. Food, standing water, contaminated surfaces and objects. A break in the chain can include medical treatment or testing the water. Portal of exit, number 3, is a mode of escape, a way for the germ to leave the reservoir. Drainage, secretions, urine, stool, blood, breathing, sneezing or coughing. A break in the chain could include wearing a mask, covering the mouth when coughing, or sneezing into your arm. Number 4, method of transmission. Ways for the germ to get from one person to another. How germs are carried from portal of exit to portal of entry. For example, by contact or touching an infected person, by breathing infected air, by eating or drinking contaminated foods or fluids, by touching contaminated surfaces or objects, and finally by vectors such as mosquitoes, rodents, or ticks. Break in the chain would involve hand washing, avoiding contact with infected individuals. Number 5, portal of entry, a way the germ can enter the new person's body. These could include cuts, mucous membranes in the eyes, nose, and mouth. A break in the chain can be a mask, insect repellent. Finally, a susceptible host. Everyone is susceptible, but the very young, the very old, and the immune-compromised people are most susceptible. Susceptibility can be increased if a person is in poor general health, with a lack of cleanliness, or a person who is drinking or eating poorly, a person stressed or tired, and people who are already ill. Any break in the skin, indwelling device, IV port, Foley catheter, feeding tube, all increases susceptibility. A break in the chain could include immunization, health promotion, medical treatment. Practice good personal hygiene, wash hands, and promote healthy living practices. Again, if any of the links in the chain are missing, the chain is broken, and the potential for infection is greatly reduced. Risk factors for infection. Various factors put a person at higher risk for infection. They would include, as I have mentioned some already, poor nutrition, inadequate diet, dehydration, chronic disease, stress and fatigue, and poor personal hygiene. Caregivers have such an important role related to these risk factors, given the population you're caring for in the home. For example, regarding dehydration, you can assist by offering and encouraging fluids. Regarding poor personal hygiene, showering or bed bath will improve a person's personal hygiene. Stress and fatigue can be reduced in clients and family as caregiver relieves some of the burden. Risk factors are always present, but you can reduce them by the care you provide. You make a real difference in infection control. We can't eliminate these risk factors, for example, age or chronic illness, but we can do our part to promote and maintain a clean and healthy home, which is our work environment. In this way, we will reduce the risk of infection. Hand washing is the single most effective way to prevent the spread of infections and disease. You may already be aware that the easiest way to spread germs or catch a cold is by not keeping your hands clean. You may know that if you don't wash your hands after eating or using the bathroom, your germs are immediately spread to the next thing that you touch, such as the telephone or doorknob. When should you wash your hands? When you first arrive at a client's home and visible to the client if possible. This is also reassuring. After introducing yourself and before you shake hands, before touching anything, like your phone or their phone, wash your hands. You could bring in Purell or hand sanitizer with at least 60% alcohol. And wash right in front of the client and or the family. Again, this is reassuring and comforting. Wash your hands before and after putting on gloves. After handling soiled laundry. Before coming in contact or preparing food. And before and after handling raw meat, poultry, and fish. Before and after you go on break. Wash your hands before and after eating and after using the bathroom. After coughing, sneezing, or blowing your nose. And immediately after hand contact with blood or other body fluids. Washing your hands and wearing gloves before contact with body fluids is most preferable and safest for both you and your client, of course. Wash your hands after touching anything that may be considered dirty or picking up objects off the floor. And washing your hands frequently throughout the day. When washing your hands, there's some guidelines to follow. They include: use a paper towel to turn water on and off. Rinse the bar of soap before and after using, or use a hand pump, preferably a hand pump soap, which does not have to be antibacterial. Avoid touching the sink or wastebasket with your hands. Do not lean against the sink. And it is the rubbing or friction that helps remove germs. Use enough soap to get a good lather, and rinse with warm water above the wrists and down to the fingertips. It's very important to know how to properly wash your hands to prevent the spread of infection. Simply rinsing off with cool water is not enough to properly disinfect the hands. Again, hand washing is the single most effective way to prevent the spread of infection and disease. I'm going to show you a brief video of the procedure. Okay, so you saw the procedure technique, and I'll just review it one more time. Make sure you have all the equipment you need available: the soap, paper towels, nail brush, if used, and a wastebasket. Turn the faucet on with a paper towel if available, and adjust the water temperature to warm. Wet your hands 2 inches above your wrists. If available, apply liquid soap. The liquid soap does not have to be antibacterial. Work into a lather and scrub hands for at least 20 seconds. Rub vigorously. Friction is important. Make sure to get between your fingers and nail beds. Try humming to yourself "Twinkle, Twinkle, Little Star" or "Happy Birthday" twice, and that would be about 20 seconds. Keep your hands at a lower level than your elbows to prevent the dirty water from running back onto your arms. Interlace your fingers to clean between them. Scrub fingernails with a nail brush, but I liked when they did their palms, and that seems to work well also if you don't have a nail brush. Rinse well with warm running water. Dry your hands with disposable towels rather than using the family's cloth towels hanging on the bathroom rack. This prevents the transfer of bacteria to your just cleaned hands. Turn off the faucet using a clean paper towel. Dry hands completely and feel free to use hand lotion. And if you have to open the door to get out of the bathroom, you can use your paper towel before you throw it out. It may be easy for caregivers to forget to wash their hands, especially when they're very busy. But doing so can cause germs to be spread and the client can become very sick. It can be more difficult for your clients to fight off infection.
Quilt didn't know,
The
but
hand
it works so well,
sanitizer.
people can...
The hand sanitizer procedure. Just like washing your hands, there's a proper way to disinfect the hands using a hand sanitizer. Hand sanitizers need to contain between 60 and 95% alcohol. Are the most effective substitute for hand washing. Pump a decent amount of hand sanitizer into your hand. Amount is based on the size of your hand. Using too little does not allow the entire hands to be cleaned, and using too much makes it hard for the hand sanitizer to dry. So it's important to find the right amount, which is usually about a dime size. Make sure you clean in between your fingers and your wrists, especially if you have been wearing disposable gloves. Rub your hands together until your hands are completely dry. Do not use towel or dry your hands with paper towel if cleaning them with a hand sanitizer. Also, I just want to mention, if there's any dirt on your hands, be sure to rinse them off first, then use the hand sanitizer. Most of your clients will not have to wash their hands as often as the caregivers, since they're not touching as many things, but there are plenty of times when clients should wash their hands. After using the bathroom, after they sneeze, cough, or blow their nose. This is not only polite, especially if they have a cold, but also to avoid passing on germs to their caregivers. They should wash their hands before and after eating. Clients could follow the same procedure for washing their hands as caregivers, and can consider keeping hand sanitizer close by. Caregivers, by example, can teach their client and family how to properly wash their hands. And we have a little video to show on hand cleaning with hand sanitizer.
Right there, perfect.
forget their bathroom experience, just like they forgot Conductor Randy, who sees all and forgets nothing.
Skip it.
At least he's not Constable Bob.
Now you can.
Certified dermatologist in San Diego, California. It's back to school this week, and I'm sure that you've already got your little kiddos their pencils, pad, and paper. But did you remember to get them their alcohol sanitizer? Well, maybe not quite that size. One that would fit in their backpack, more like that. But it's an important thing for them to have because there's lots of cute kids in school. There's also lots of nasty germs in school. So I'll actually show you how to use it, and I think you should show your kids too. Most people use alcohol sanitizers the wrong way. Here's the right way. Put a little bit of alcohol in your palm, like that. And then you rub it in. But here's where most people go wrong. They stop there. In fact, that's not nearly enough. You have to keep rubbing. Because the alcohol works only when it dries. And it only kills the bacteria that you're able to kind of scrape off your skin. So you have to rub your hands hard. You have to rub your nails, rub your fingernails, and get in between your fingers, just like this. And you keep rubbing and rubbing and rubbing until it builds up a little bit of friction and the alcohol dries completely. Then 99.999% of all bacteria are gone. So thanks for tuning in. If you've got more questions for me, then write to me at Durndump on Twitter.
Great. Now we're going to discuss the correct use of gloves. Disposable gloves are not worn in place of hand hygiene, but as an additional precaution. So when should you wear gloves? When touching other people's cuts, sores, or rashes, cleaning up blood, vomit, or other body fluids, touching dirty laundry, touching trash and garbage, cleaning with chemicals, bathing, showering people, pericare. The correct gloving practice. It's important to choose the right size of a disposable glove. Too tight, it tends to tear, and too loose, it's hard to work with. Cover any cuts with waterproof dressing. Don't wear gloves any longer than necessary. Check for tears before and after use. Remove gloves carefully, avoiding contaminating hands, and then dispose of them. Disposable gloves are single-use only. Never reuse or wash them. Prevent damaging or tearing gloves by avoiding excess jewelry and long fingernails. Keep nails short and clean, no acrylic or artificial fingernails. Caregivers must be willing to sacrifice style for the health of the client. Studies demonstrate that healthcare workers with artificial nails are more likely to harbor pathogens or germs than those with natural nails. Please research this topic if you're interested. There is a lot of information on this important subject. Keep hands away from face, eyes, and mouth, nose, hair when wearing gloves, for that matter, as much as possible and after washing hands. TLC provides vinyl gloves in medium and large sizes. Let us know if this isn't satisfactory. Also check if you have a latex allergy, and make sure that the gloves do not contain latex. Here comes that train. Wash your hands with soap and water before and after wearing gloves. Do we have,
Is this the one you want?
No. I can. Okay. I have a short video. Yeah, I guess so. Yeah. Sorry.
It's okay.
Okay.
It is that. Oh, good.
Forward it was. Yeah. Just what do you?
I have to turn the volume back up because I was not going to do that again.
So we're going to see a demonstration of donning and doffing the gloves.
Always ensure the right type is chosen for the type of work and potential hazards. Make sure the right size of glove is used. Measure your hand using a glove sizing chart. Wearing the right size will reduce the potential for tearing and also ensure freedom of movement for the hand. Remove any jewellery that may rip the gloves and wash your hands before donning gloves, as well as after each glove change. To don, first select a glove from the dispenser and check for any visible tears and other defects. Gently open the glove at the cuff and insert the hand into the glove. Once the hand is inserted, move the fingers down into the glove's fingers to properly align it and ensure you have a snug fit all over. Roll the cuff of the glove down the wrist until the glove is secure. And now apply the same technique for the second glove. When removing, first, grasp the outer edge near the wrist area. Fold it over and peel it away from the hand, turning it inside out as it goes. This will trap potential contaminants inside the used glove. Once the glove is off, hold it with the gloved hand. To remove the other glove, place the bare fingers inside the cuff without touching the glove's exterior. Now peel it off from the inside, turning it inside out as it goes and using it to envelop the other glove. Finally, discard them appropriately and never wash or reuse disposable gloves.
Thank you. Maintaining a clean environment is the next topic, and it includes food safety and laundry. Maintain good personal hygiene and help your clients to do the same. Bathing, washing hair, brushing teeth, and wearing clean clothing are all grooming practices that help to prevent the spread of infection. This is a perfect opportunity to lead by example. Cleaning is so important as germs do not have anywhere to live once dirt has been removed. We all know that floors can be dirty, but as we only walk on them and never use our feet to prepare food, the risk of getting infection and spreading it from the floor is low. You touch everything in the home, so you need to keep all surfaces clean to keep germs from spreading from your hands. You should use detergent and hot water to clean all surfaces. You should always clean the dirtiest area in the home last. You should clean the kitchen before the bathroom, and you should clean the sink and shower first, and the toilet last. You should have separate cleaning cloths for the kitchen and bathroom, and for the toilet and the sink. Very important areas you need to clean are the things you touch, which you could use something like a Clorox wipe. Check the product labels. These would include phones, remote controls, keyboards, doorknobs, light switches, refrigerator handles, faucet handles, toilet flush handles, all things that can be forgotten when people clean. Include these in routine cleaning. The kitchen, clean as you go. The kitchen is a high-risk area for spreading infection. Wash your hands before you touch food. Make sure the counter is clean before putting any food you're preparing on it. Most of the time it is okay to just wash the counter with soap and water, and always wash the counters after preparing food as well. Dishes and the kitchen sponge. Use a sponge or dish rag to wash the dishes with hot, soapy water. When you're done, wet the sponge, wring it out. Make sure that the sponge is damp and put it in the microwave for 1 minute. Make sure the sponge is damp, otherwise it can catch on fire. You can also wash the sponge and dishcloths with the dirty laundry. Cutting boards. It's best to have two. One you never use for anything but meat, and one you would use for foods that you don't have to cook to eat safely. Always wash boards with soap and hot water and rinse well after each use. Check dates on food. If food has expired, throw it out. Make sure the dishwasher is working properly. Have paper towels handy. Clean as you go, and clean the dirtiest areas last. To sum it up, clean the kitchen before the bathroom, toilets last, and use separate cloths. The bathrooms. Germs get into our homes all the time. They can come in on food, people, pets. For example, there's a lot of germs in the toilet bowl, and the risk of spreading is low. However, cleaning cloths, sponges, towels that come in contact with the germs help infection to spread. Cleaning is very important as germs do not have anywhere to live once dirt has been removed. The bathroom is a high-risk area for infection. Always wash your hands after using the bathroom or toilet. Make sure you read the label on products you're using. You want to make sure you're using the product in the correct way and that it will do the work you want it to, and it won't ruin anything in the house by damaging it with the wrong cleaning product. Read important cautionary information and use gloves. Wipe surfaces that are dirty before using products. Even disinfectant cleaners can't always get through a large puddle of liquid or layer of dirt to disinfect the surface underneath. A cleaning product removes dirt and grime, and a disinfectant kills the germs. Use hot water and detergent for cleaning the bathroom. Routine use of disinfectants for bathtubs, shower curtains, sinks, and surfaces that are often wet will keep mold or bacteria from growing in those places. If there's a ventilation fan in the bathroom, make sure to turn it on whenever you use the shower. It will keep the mold from growing. Use separate cloths for cleaning the bathroom sink and one for the toilet. Clean the sink first and the bathroom last. Toilet. Sink first, toilet last. Laundry. Start by reading the labels on the sheets, clothing, and detergent. When changing sheets on the bed, fold up the dirty sheets away from you and inward to avoid touching the sheets with your clothes. If soiled linens with body fluids, wash separately from other laundry. And again, wear gloves when you're handling dirty, soiled linens. Using the hottest cycle in the washing machine along with laundry detergent will disinfect sheets and other fabrics. When cleaning or involved with laundry, take care not to stir up the dust. Do not shake linens when making beds, and wipe dusty surfaces with a damp cloth or mop first. It helps to prevent the movement of dust and lint into the air. Food safety. Proper hand washing and sanitation help to prevent infections from contamination. I have mentioned a lot of these in the kitchen topic of my talk, but I will mention them again as they are related to food safety. Ensure food safety at home by washing hands with hot soapy water before touching food. By now you're familiar with the proper hand washing techniques. Wash all produce before cutting, cooking, or eating. Wash utensils and cutting boards after each use. Keep kitchen surfaces clean. Keep raw meat and ready-to-eat foods separate. Cook food to proper temperature. Keep unserved food covered at all times. Refrigerate food promptly to below 40 degrees Fahrenheit. And pay close attention to the use-by dates. Finally, I wanted to go over a go-to bag you could have in your car. This is mine.
Looks like a go-to suitcase, Cathy.
I'm going for a trip, on a trip. It has a zipper, so it can be closed. In the outside pocket, I have plastic bags because you will have trash or if your clothes are dirty. I also just put in a paper and pen if you need to write something down. It's handy. And then inside, there is one zippered pocket of which I have Band-Aids and masks. If you have a cold or your client has a cold, it's handy for you to have some masks with you. Also, in the middle part, I have a roll of paper towels and wipes, disinfectant wipes, which you can use to clean some of the things we talked about, the remote controls, the phones. I have a change of clothes, scrubs I can put over my clothes. And I have some hand sanitizer and a soap pump. Happens to have antibacterial, but you could just use regular hand pump soap. I think that's, and a bag with disposable gloves. I would not want to be caught without them. So, items to have in your car if they may be needed when providing care for your clients in the home. These would include a change of clothes, paper towels, liquid hand soap, hand sanitizer with 60% or over alcohol, detergent wipes, Band-Aids, plastic bags, gloves, masks, in a zipped up bag, and anything else that might be handy for you. So to review, I discussed infection control and the chain of infection, risk factors, hand washing, use and putting on and off disposable gloves, maintaining a clean environment, cleaning, laundry, and food safety, and the go-to bag. But the biggest, I would say, takeaway in this presentation of infection control is hand washing. Do you have any questions? If so, you can email me at Cathy with a C at tlcnursing.com. Thank you for your attention.
Thank you, Cathy. Very well done. I'd offer a suggestion for the go-to bag.
Yes.
A flashlight
Perfect.
should be in there too, just in case the caregiver has to access it at night. So they would be able to go to the bag and have a flashlight right in the bag.
Perfect. And there's the quiz. How do they?
We'll just fill that out, and in terms of the caregivers who might do this online at TLC Academy, we will attempt to put the 5-question quiz
On.
as a post-test that they can complete right online after they view this video.
Great.
Again, thank you all for your attention today to TLC Academy, and as Cathy pointed out, I remind you as Director of Nursing for TLC how important it is for you to continue your education, and TLC will continue to provide for you opportunities such as this one, not only to attend in person, but also to have access to on TLC Academy. So thank you and enjoy the rest of your day.